What's up, guys? It's Dr. Tim Jackson here with another episode of the Boss Body Podcast. We have another very special guest with us today, Dr. Rob Downey, MD. Dr. Downey is a board-certified family medicine physician and first witnessed exceptional clinical outcomes in response to functional medicine back in 2006 when his natural medicine mentor turned around a severe autoimmunity case by using whole food, probiotics, and safe, potent anti-inflammatory botanical supplements. Dr. Downey is driven to connect with other people, listen deeply to what they are experiencing, and ask with them what's next, where do we go with our thoughts and actions to be whole and healthy. It started in childhood, talking with friends and family while hiking in the mountains of Western Montana, and continues to be part and parcel in the IFM-informed therapeutic alliance he endeavors to form with every patient. He finds that there's a beauty, transparency, and honesty in the doctor-patient relationship when approached this way. His patients report this approach creates space for them to get over their hurdles and be their best. Welcome, Dr. Rob Downey. Thanks for being here.
Oh, thanks for having me, Dr. Tim.
Well, so I know you're out in Alaska, so you surprised me. I think it was 2 years ago, roughly, when you and I were speaking online, and I found out you were doing functional medicine. Probably my ignorance to a degree. I didn't really understand how much functional medicine took place in Alaska. Is that where you originally started practicing?
No, I started in Montana with my mentor, who was a naturopathic doctor, but my wife and I had really fallen in love with Alaska because we lived north of the Arctic Circle for a couple of years back in the year 2000. So when a medical director at an integrative clinic job came up here, we moved back. And here we're south of the Arctic Circle. It's kind of the banana belt of Alaska, or what people would think of as postcard Alaska, with brown bears and humpback whales and sockeye salmon and sea otters. It's pretty magic.
Absolutely. And so how would you say the climate of Alaska, the lack of sunlight during times of the year, how does that impact your patients and you personally?
Well, I used to have quite a bit of seasonal affective issues growing up in Western Montana, which was cloudy in winter. And when I wasn't a functional medicine provider from 2000 until 2002, when I lived north of the Arctic Circle. So the lack of light really messed with me. Over half of my seasonal affective issues improved with vitamin D supplementation, whole food plan, lots of sleep, lots of exercise, positive attitude, connecting with my peeps, managing my stress, just lifestyle stuff. But I did used to benefit from one of these seasonal lights. And I think the technology is pretty cool. Just get a certain number of photons of the retina, same time every morning for about 15 minutes, Halloween through Easter, and just get that arbitrary dawn triggered at the level of the pineal gland. So I'm really quick to recommend that. And I wouldn't hesitate to go back to it if I needed it. But I'm kind of fascinated by the adaptation aspect, that the difference between here and north of the Arctic Circle is that I take great care of myself now, and I don't need the seasonal light. So I don't know what the science of that is, but maybe I create my own inner dawn because I feel so dang good due to medicine. I don't know.
Yeah, you're doing something right. So in terms of diagnoses or imbalances that you see, do you see a lot of patients with fatigue?
Yeah, it's my number one. I don't know about in your work, but every once in a while we'll do this analysis, right? Just of the top codes we see and treat. And the number one is fatigue, I suppose, for pretty obvious reasons to our audience. But the other thing is just that in functional medicine, it sometimes won't occur to people that fatigue's an issue. And so I'll say, do you have perfect energy all day, every day? And they'll say, well, of course not. And I'll say, well, in functional medicine, that's fatigue. So that's going to be part of what we figure out. And that way we can do adrenal testing and mitochondrial support and the kinds of 6-part thyroid panel screen just right out of the gate. And so I think people get better quicker here, either with a primary diagnosis of fatigue or remembering it's part of a constellation of things that's on the to-do list to get well with functional medicine.
So what are the most common culprits behind fatigue? Because it seems like such a blanket, generic term that can be
Yeah.
driven by so many factors and variables.
Yeah, I think it can get overwhelming. Part of how I simplify this in my brain and my approach is realizing the trend has been for me, because I don't do primary care. I have a policy that people need to have a primary care provider, and that's so I can devote all my attention to functional medicine. So I'll just say, okay, you don't have optimal energy. We've identified that. Do you have cancer? Are you anemic? Are you depressed? Like, just the list of the biggies for the conventional medicine workup. I really encourage people to get that housekeeping done. It would be embarrassing and sad to have somebody do a lot of supplements and adrenal testing, and then they've got a bone marrow malignancy or severe depression or something like that, severe anemia. So I really think the conventional workup has a place.
Yeah.
But you and I take care of that host of folks that they're not depressed, they're not anemic, and they don't have cancer. And then they have their conventional provider say, you're fine, which just drives me crazy, right? Because it drives them crazy.
Mm-hmm.
And I really, really wish that conventional providers would say, you are reporting this issue, but I don't know why. Because that would open the doorway for the person to say, feel heard and respected,
Right.
and then to know they need to take next steps to.
Or you see psychosomatic written in the chart when you know it's not.
Well, I mean, Larry Dossey did some really fascinating work on damning patients, that some of the people I take care of, it's part of their trauma history that they were told you're fine. And they felt like, well, I just spent 3 visits saying, like, I can hardly get out of bed. I can't think straight. I don't do what I used to do. I'm not nice to my kid anymore. My boss hates my guts. Like, something's wrong. So they feel disrespected to be told you're fine. And I feel a little bit of liberty to pick on conventional medicine because I'm conventionally trained and functional medicine trained, but also because I committed some of those acts myself. I made those same mistakes before my functional medicine training. I would say, I just didn't realize that a much more respectful answer is, you are tired and I don't know why. Who can we get you to that will help you figure that out? And the patients, that enhances their respect for the provider, that transparency and honesty. So
yeah, I agree. I mean, I've had cases and clients where they come to me and I say, yeah, I know the basics on this topic, but I know someone who's a subject matter expert. And people say, oh, that's crazy. Why would you do that? Well, number one, because it gives them the best care. Number two, they end up coming back. So they're like, wow, he really had my best interest at heart.
Mm-hmm. Yeah, it's that compass heading of just what does it take for this person to thrive. That if we're always striving to answer that question honestly, it just is like, the magic elixir for everything.
Right. Absolutely. So underneath, I'm not really big on diagnostic labels because they don't really tell us the mechanisms underlying that. But if you had to pick the top 3 or 4 diagnoses, for example, rheumatoid arthritis leading to fatigue, what would you say you see the most in your practice, top 3 or 4?
Yeah, thank you. And I should say, sorry, I didn't sort of proceed on to answer the functional medicine arm of the question. So thankfully, I've got a lot of pattern recognition there. And so I think the big 3 are suboptimal lifestyle, like literally just the person's puny because they're sedentary, they don't eat whole food, they don't socially connect, they don't manage their stress, and they don't move. And so just suboptimal lifestyle is definitely number 1. And then the 2 other biggies for me are that the adrenal and the thyroid operating systems in our body are our energy regulators. Mm-hmm. And so they rise and fall together. And so everybody that I see for fatigue first visit gets a 6-part thyroid panel. And I I'm a fan of the Dutch Plus test of adrenal function that has a metabolized cortisol, free cortisol profile, free cortisone. But like for women who take oral contraceptives or don't cycle regularly or don't want to have to do ovulation strips to capture a Dutch test at a certain, point in the cycle, or just who are overwhelmed by the complexity of that test, I like just the free cortisol profiles with a DHEA and a cortisol awakening response. Like, ours is through Genova, but of course there's lots of them. And, all of these folks that I treat, I'm just always lobbing mitochondrial support in there. So I guess that's the fourth corner of my, it's probably the big four actually, because I'm always using B complex. I'm always using magnesium. And I've just found just about everybody needs a little mitochondrial support because it's such a great life hack. If you're, if your body were a race car, the easiest move to get cut a few seconds off your lap time. It's a little magnesium and B complex.
I just did a solo cast last week, was released a few days ago, and it was only 15 minutes, but I broke down my three-pronged approach to mitochondrial health. One being providing the substrates like coenzyme Q10, carnitine, B vitamins. Two, the healthy phospholipids to reconstitute the mitochondrial membrane. And then lastly, protecting the mitochondria with glutathione and superoxide dismutase.
Love that.
And so I think a lot of people are just taking massive doses of carnitine and CoQ10, but that's just one, facet. But if you address it from all angles, you can use much lower doses. That's what I found.
Yeah. Huge payoff. Yeah.
And so suboptimal lifestyle, let's unpack that a little bit. So sleep issues, I'm guessing, are pretty high under that.
Yeah, I notice most of the people I take care of in the early going, thankfully with some exceptions, but they just assume they get enough sleep because they have the American conception that sleep deprivation is normal. So either their hours are adequate, but it's not restorative. Many of them are exposed to the blue light of their screens and or the screen content itself, which is increasingly disturbing nowadays, unless people are really thoughtful about what they put in their brains from their digital device.
Absolutely.
And there's legitimate origins for the challenges that are happening in the world. I'm not dismissing that, but I like the idea that we thoughtfully consume that content once or twice a week to stay up to date on what we care about, not for 2 hours every night.
Right.
And so sleep is one of the ones where nowadays I'll just talk to people about, hey, a single night of disrupted sleep is reflected in diminished immune resilience the next day, one night.
Yes.
And so I encourage people to think of wherever their pillow is as the palace of their restoration. And I deliberately use this kind of provocative or almost sort of, feminine or nurturing term for this space because it helps people think maybe I need to get a little clutter out of the bedroom. Maybe the TV needs to go. Maybe I need nicer sheets. Maybe I need shut out blinds. Maybe I need to cool it down. If we come into a bedroom and it's noisy and cluttered and, full of stuff and hot, I mean, how's somebody gonna wake up the next morning refreshed? And again, I've had to do the same thing myself. I made assumptions over the years as a medical student. Sleep didn't matter. I paid the price for it. And now I just know it's the magic. And then I find that people who say, oh, seriously, like I actually do need 8 to 9 hours of sleep, probably. I love it when they come back and say, this is great. Oh my God.
They're like a different person.
Sleep. And so talk about low-hanging fruit. Like that's 6 inches off the ground.
Yeah, seriously. So, I mean, it seems like we've, as a society, the United States and possibly even the world, we've normalized pathology. I'm in beast mode. I'm an entrepreneur. I own 3 businesses. I sleep 3 hours a night. I'll sleep when I'm dead. I'm like, you might be dead sooner rather than later if you keep that up.
I'm really concerned about that we've glorified it because, again, that was the culture of my medical school and residency. Well, in all fairness, my residency were a bunch of groovy folks heavily influenced by the 70s who actually did care about work-life balance. So I'm not going to pick on them, but my med school treated it like if you're not asleep at the nursing station at 3 a.m, rather than back in the break room, we won't even involve you in a delivery, right? That whole macho thing.
Yeah.
And if you couldn't hack it, then it was treated like, well, you're not serious about your training as a healer if you're not into all this deprivation and pushing yourself.
And that's just
And
not
so,
true.
well, it's literally the opposite of what we need. And so every air traffic controller, every nurse that works the night shift, every person that works any night shift, I thank them for their service. Every person in the military. I just wish our society was built in an equitable fashion where people knew the score before they signed up for that particular gig.
Right.
We probably should put those folks on a night. We should make them night owls and literally flip their circadian rhythm for 3-6 months a year and do it between the ages of 20 and 30.
Mm-hmm.
So, I mean, there is a sensible way we could get the things done that have to be done for our safety.
Right.
But where we just say, no, it doesn't matter, just push on through. It's just so untrue. And for folks who are puzzled by why they don't sleep well, and it is within their locus of control to change their sleep. Wow. I mean, right away. Yeah. Like right now. Because again, half the things you told me need to be fixed are probably going to be gone when you're sleeping well. So let's just get those off the table.
I had Dr. Tammy Miraglia on the show yesterday, and I referenced a study. I think it was at the University of Texas. They took medical students, had them in the lab overnight for several nights, and they had the EEG monitors on. Every time they went into deep sleep, they would shake them, wake them up. After I think it was 3, maybe 4 nights at the most, they all had signs of either overt diabetes or prediabetes, hypertension, and cognitive deficits bordering on dementia.
Yeah. Yeah, you're giving me flashbacks, actually.
Sorry about that.
No, I'm just thankful I don't do that now. But I remember the thing I flashed on when you said that was that when the pager would go off for the 6th or 7th time at 4 a.m. for an admission, when I was in med school and residency, and also during those 2 years I was in Kotzebue, there was a physical pain to my whole body, which I would call fatigue pain. And I think it was just my body saying, you got to be kidding me. Right? Like, you're torturing me, man.
If anything, we need to be more in tune to those signals, not ignoring them.
Yeah. So again, anybody that's got the blessing that it is a modifiable variable for them, sooner the better. And again, if they want to be the monster entrepreneur, if they want to have 3 businesses, that's their superpowers to get enough sleep, because now they've got an edge over all the sleep deprived folks who don't have the creativity of the prefrontal cortex and are making simplified strategies based on their midbrain and amygdala. Like, it's the ultimate competitive advantage.
Right. Absolutely. I mean, I know the High Performance Institute, with all the entrepreneurs and business owners, they say when they've done study and data collection, it's not the people that keep pushing. It's the people that say, okay, I've reached my limit. I'm going to turn it off for the day. They're the most successful.
Oh,
every
yeah.
time.
Yeah. And also, since your podcast is called the Boss Body Podcast, it's so important for recovery. I mean, if you look at the folks that have the physique they want, they take recovery very, very, very seriously, including enough sleep.
Yeah, bodybuilders. I know a lot of bodybuilders who they're adamant about getting in bed by 9 p.m. to get their growth hormone spike. So we can learn something from the muscle meatheads, once in a while. So suboptimal lifestyle. We talked about light deficit or too much artificial blue light. We talked about poor sleep, junk sleep. What else do you see? You see lack of connection, especially in an area where it may not be as easy for people to connect because of the weather?
I think that's a good one to flag now, because for the last 2.5 to 3 years, social circumstances have led folks to think that less social connection doesn't matter, or that Zoom is the same as being physically present with someone. And we were drifting that way anyway, right? Where a young person who would have been part of family storytelling even 20 years ago in the evening is already on their video game by then. My wife's a pediatrics provider, and her kids that log their screen time are, some of them are averaging 7 hours a day.
Of screen time?
If you think about all of the stuff they do related to school, the social media, the gaming, the email checks, it's mathematically staggering even how those numbers are logged. And I don't want our audience to feel like I'm picking on the kids and letting the adults off the hook. I mean, we're talking about an epidemic prevalence level of everybody super saturated with digital time at the expense of social connection. And so credit to Mary Agnes Antonopoulos, who I was chatting with 5 or 6 years ago, saying social isolation is the new smoking. It's such a helpful, simple phrase for us to realize the full impact that we physiologically, biologically, our native genetic predisposition is to connect and support one another. And without that, our immune systems fall off, our adrenal function becomes suboptimal. It's pro-inflammatory. A lot of your audience is going to want to get ahead of on top of silent inflammation. Social isolation is pro-inflammatory.
Absolutely.
So just I suppose, again, a lot of people feel like they need to tough it out. They don't want to bother somebody. They don't want to take the risk to be vulnerable. But I'm really careful to practice what I preach. And so I take risks with my peeps. When they ask me how my day was, I actually tell them.
Yeah.
And I'll take the time to contact siblings and catch up, or even just send them a recommendation of a book or a movie or a new album I think they might like. And the digital part that still is social connection is having somebody say, hey, I like that new album you sent me.
Right.
I'll stop and linger longer on, oh, I care about this person and they care about me. Right. So I don't want to imply that digital connection doesn't matter, but in person, digital, looking out for others, getting that support, that vulnerability, it's kind of like the sleep thing. Mm-hmm. People will tell me, oh yeah, I'm socially connected. But then when we inventory what's really happening and challenge that person, right, to up the dose, they'll come back and go, yeah, I was isolated.
Right. Absolutely. Yeah, I agree with you. I think it is the new smoking. I mean, some people say sitting is, but I think it's a combination of the two. And, back in the day when someone got sick, the entire village rallied around them. And then if another person got sick, the entire village rallied around them. It literally takes a village. And, now we can live in a neighborhood or in an apartment or condo complex and not know who our next door neighbors are.
Mm-hmm. Yeah, just to add to what you're saying, Dr. Tim, for any of our audience who feels like they don't feel as well as they want to, but they don't know why. I would just a challenge I would throw out there. Think about somebody you really care about, you haven't talked to for a while or connected with, or especially think of somebody that it would make a difference to them to show up for them. Like, they had a hard week, or they've been struggling with a difficult boss, or their kid just got sick, and spend 5 minutes or 10 minutes just seeing how they're doing. And then stop and just pay attention to the feeling in your head and your heart and your body. It's literally the feeling of health.
Right.
That's telling us. It's telling us something. Yeah.
Yeah, absolutely. We talk a lot on this podcast about the vagus nerve and ways to stimulate it, but social connection is one of the best ways out there. No biohacking gadgets needed. And you need it for a multitude of reasons. Great support system. You feel supported through your challenges. People rally around you. You rally around them. I mean, I read an article a while back, and it said the number of social connections, intimate social connections you have at age 50 is a very strong predictor of health span and lifespan.
Mm-hmm. Makes a lot of sense, doesn't it?
Yeah, absolutely. Yeah. So, we talked about sleep, light, and social connection, none of which include any supplementation or any expensive gadgets or anything like that. So I think a lot of times people think, oh, if I don't have the money to get healthy. but it doesn't take a lot of money to get healthy. Got to have those foundational pillars in place before you get to the advanced stuff.
Yeah. I got to give some credit to the folks that I've been privileged to care for over the years. Montana and Alaska, to some degree, are hard places. There's that's where I practiced. And so there's a lot of geographic challenge, whether it's the weather or the distances people travel. There's some of the lowest levels of economic compensation in the country. And so I couldn't, I couldn't successfully use the approach in the places that I practiced without people just laughing at me. Like, right. You got to be kidding. I can't take $100 worth of stuff right now. I can take $0 worth of supplements today. Right. And so the great blessing of that adversity was that I did not fully appreciate the power of lifestyle. And this really just forced me to understand it, because the person would come back and say, yeah, I'm hydrating, I'm sleeping, and I'm talking to my brother on Fridays, and I'm 40% better. Wow. So that when we were getting ready for today's session, we just talked about how you can't supplement your way out of a lifestyle deficit. And so now my patients know, hey, they'll come in and they'll just want supplements, but their lifestyle is really underwater. And I'll just say, hey, with all due respect, when you're ready to play the lifestyle card, come back, because I don't want to waste your resources. And just like you were talking about earlier, they're like, whoa, the guy's not selling me supplements until I've got skin in the game.
Right.
I didn't see that one coming. And then I love it, though, that this isn't like Olympic athlete stuff. This is lifestyle is also dose independent. Mm-hmm. So one social connection, one dose of chia pudding, one good night's sleep has this qualitative effect where we say, wow, I've got this. I've got momentum. I want more. Mm-hmm. So I don't want people to feel like they have to do this for 3 months before they get benefit, or that they have to have 3 hours a day of, sleep modification and a nap and, binaural beats and all that stuff. Like, it's so nice that this is just, it's just about just taking the act of asking, who am I? How do I want this? What do I believe in? How can I get curious and lean in these domains and just take action? And it's just shocking how much yield comes.
You still there?
Yeah.
All right, Marcel, cut this out. I don't know what timestamp is, but you'll find it. All right. So what was the last thing you said? I'm sorry, it froze.
Little dose. And then it's really fun when they like something and they find and they make it theirs, then they can get even more benefit by pushing the dose. So it works both ways.
Right. Absolutely. Have you seen a lot of situations where you treat once, let's say the wife, and then, the husband has an unhealthy lifestyle. So then that kind of creates discord. So you end up treating the whole family, or at least both parents.
Yeah, I see it quite a bit. Two things happen there. Guys more so than women. Some of them will start the visit and say, my wife sent me. And so the first conversation I have with them is I say, let's talk about whether you want to be here.
Right. Because
my wife sent me won't actually get you anywhere.
Right.
Except for credit for coming in today. Right.
Right. Absolutely.
But I'll just say, the thing I love much more, though, is just that so many guys are kind of pragmatic. And I don't know if that's how guys are built or not. That's how it seems to me. But it's kind of like if the mechanic says, well, I did the analysis on your chip and your carburetor is, overly rich, right? So you're laying down deposits where they don't belong and you're burning extra fuel. Once that chip says that, it's like, okay, tune the carburetor. I'll pay you to do that because I want my vehicle to run.
Right.
Most guys change the oil in their vehicle because they don't want the consequence of not changing the oil, and they think it's a nice thing to do for their car or truck. Mm-hmm. So when they see their spouse have 50, 75% improvement in their energy, their mood, and their joint discomfort goes away and their guts are happy. I mean, I think a lot of guys just go, whoa,
Yeah.
something's happening there. And they do show up because for themselves saying, I don't know what you did, but I want some of that. I love that. I love that vibe.
Right. Yeah. It seems like, if one person's self-actualized or bio-optimized and the other's not, it's an energetic mismatch.
Yeah.
And it creates discord.
Yeah. 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 It's really cool to witness how it inspires others in the family, or again, it creates good cognitive dissonance.
Absolutely.
Because again, some of them will go, some of the guys will be like, wait a minute, this was just whole food and 3 supplements. You got to be kidding me.
Right. Absolutely.
Like, yeah, that's all.
Can you unpack a little bit your 6-part thyroid evaluation?
Everybody knows about the TSH, the thyroid stimulating hormone. And I always remind people that TSH goes up as thyroid hormone levels go down in the body and vice versa, because it's the brain's reminder signal to the thyroid to make and release hormone. So there's a feedback loop of the brain as a sensor saying, is there enough or too much or too little? I get a free T4, which I always describe as pooled hormone or pre-hormone, has a really long half-life for about 2 weeks. And there's a optimal range according to functional medicine with tighter cutoffs than other ranges. I talk about free T3 as in some ways maybe the single most important one in terms of energy and metabolic function, and how that's made and burned. It's just around for about 6 hours. And so that free T3, we really emphasize the importance of that. We get a reverse T3 kind of described as the brake. If T3 is the gas, reverse T3 is the brake. And I encourage people not be driving around with the parking brake on. Learn more about silent inflammation if it's above 18 or other things that can drive that up. And I always get at least one set of thyroid antibodies to see if there's any Hashimoto's autoimmunity hiding in the equation. So a thyroperoxidase and a thyroglobulin antibody.
Yeah, I see so many people, and well, on the labs, at least here, LabCorp and Quest, it'll say less than 30 is normal, but in reality, that number represents the immune system's attack on the thyroid gland. So don't you want it as close to 0 as possible?
Yeah, thankfully ours are normed. I think thyroperoxidase maybe is supposed to be under 30 and thyroglobulin under 6. I'm going by memory now, so I could have those numbers a little wrong, but really low. I mean, really low is normal. The lower, the better. And what gets dismissed is just that conventional folks will say that low-grade autoimmunity has no clinical consequence. And from a functional medicine perspective, wow, we have evidence that the body has extra antibodies against signaling systems in the body. So if we're at the point our immune system is targeting a master regulatory pathway, yeah.
You've lost the ability to distinguish self from non-self.
Yeah, there's something going on there that's very significant.
Yeah, absolutely. Very significant. And it's only going to get more significant if not addressed.
Yeah.
What's something that you know today and that you impart onto your patients that you wish you would have known 10, 15 years ago?
This one has come out of Joe Rignola and I are getting ready to do this Rewiring Your Brain Masterclass. And so as we've been talking with folks about neuroplasticity, right, how our brains can change, the really remarkable thing to me has been that any of us who want that, our brains to remodel favorably, so that we avoid diseases like dementia or so that we're functioning optimally, we need to envision how we want to be and do actions that manifest that state for the brain trait to neuroplastically follow where we are leading it. And this feels to folks who are suffering like, well, I'm not at peace. I'm irritable and angry and overwhelmed, and I want to be peaceful. So I want you to give me whatever's going to neuroplastically make my brain peaceful so I get the benefit. And the work is that, yeah, the supplements and the testing and all that can do wonderful things. But the irony is that the very first thing to do is to envision peace. The very first thing to do is do a loving kindness meditation for 1 minute a day. Or, give a little grace to a workmate that, we were crabby with last week, but this week we're a little more in that head and heart space where we can say, hey, I know you've got troubles too. I know you're human too. And so the biggest thing I wish I had known is that we need to act on these altered states that we can create for the altered traits to follow. And there is a book by that title. So that's coming from that author, not me. But it's such a beautiful concept that we need to have the courage to envision it and act in ways that we think promote that, for the body to do the beautiful things, to fill in the gaps and make it sustainable. And so I challenge myself and others more now to, to do that part. And I just don't think I knew enough early in my career to know at that point. There's some folks I could have helped then if I'd known that, but
how you
we
see
do the best we
yourself
can.
in your mind's eye, I think, is incredibly important. There's a great book called Psycho-Cybernetics by Dr. Maxwell Maltz. He was a plastic surgeon, and some of the patients he got the best results on physically, they would report that they weren't happy with the results because they never changed their self-image in their mind's eye.
Yeah. Yeah, it's so important. I'm glad we're getting to talk about it a little bit. I actually, I'll have folks, I'm so glad I take histories on how much something was bothering someone, because again, this negativity bias, right? It's part of the genesis of people's health or lack thereof, but it's also part of the genesis of their ability to benefit and sustain the improvements. Because I'll have a lot of folks come back and the first words out of their mouths will be, 6 months into my plan, they'll say, no, I'm not any different. I'll say, oh, well, are you sleeping now because you complain of insomnia? Oh yeah, I sleep. Well, is your energy good now because you complain of fatigue? Oh yeah, I've got good energy. Is your mood good now because you were complaining of depression and anxiety? Yeah, that's gone. So complete resolution of their 3 severe complaints.
Absolutely.
But it doesn't occur to them that they got better. And so I think that how we see ourselves is really important. And then all of this positive psychology, gratitude part, that's the amplifier of effect, because then we can not only resolve the things that drag us down or our immediate impediments, but we can really, again, kick in those superpowers, which is some of the most fun aspect of the work you and I do. Is like, now that you've kind of taken care of your troubles,
right?
Don't you want to take the next step? And since I learned positive psychology, I realized how much another thing as a medical student is I had this kind of caustic sense of humor, that I thought it was cool to be sarcastic. And now I don't use that language anymore because it feels profoundly negative to me. So I encourage people, like, language has power. When you say such and such is horrible, do you want to think about saying such and such is very challenging? Because if you say it's horrible, that's something to run away from. If you say it's challenging, that's something to lean into.
Words are weapons.
Yeah,
absolutely. Well, thanks so much, Dr. Downey, for being a guest. Thank you for the work that you're doing. And hopefully we can have you back on in the future.
Yeah, and likewise on the Seaworthy podcast, Dr. Tim. It was a pleasure last time and today, and thanks for all the light you bring too.
Absolutely. Thank you.